I'm Dr. Martin Coleman. I'm at the Orthopaedic and Spine Center in Newport News. We all take care of different specialty parts of the body. My area is shoulder. What I wanted to talk about today was you're a patient and you start to have shoulder pain. And the question is, what do you do about it and when do you need to come and see us? Most people use common sense about this kind of question, and if you have a mild ache and you're able to resolve it with anti-inflammatories and rest and ice, you don't need to see us. The real question comes up is, you've had this for a while, and when do you give up on that approach and try to make an appointment to see us? And I think the answer is when you can't live with it anymore, you can't sleep well, you can't do your job, you can't carry out your favorite sport. If that happens and you haven't had a result with trying to be patient, trying anti-inflammatories, it's probably time to call us and make an appointment. At this point, we have the feeling that we can solve most shoulder pain problems by a variety of approaches, be it injections, therapy, or even surgery, but most shoulder pain can be solved. People will come to see me because they have shoulder pain, and the typical sequence of events is we'll talk about how it started, whether there was an injury or not, whether it's a long-term condition, short-term condition, and how it's responded to anti-inflammatories, Tylenol, that sort of thing. If a person comes in and says they've tried all those things and it hasn't gotten any better, then we start to go one of two paths. One group of patients will obviously have simply a bone spur, which has caused the pain in the shoulder, and they respond pretty nicely to things like medication and a cortisone injection. Other people have gone past that point, and now they actually have a tear or something more permanent, and those people need to get a workup. Typically, we'll get x-rays at first, and then eventually get an MRI of the shoulder, which gives us a good insight into the pathology of the shoulder, what actually is torn, what's damaged. And once we have that information, we can usually make a successful game plan to resolve the pain. Our patients with shoulder pain typically fall into two categories, young and old. And the young people all tend to have problems relating to the stability of the shoulder, things like a partial dislocation or full dislocation, or even the subtle instability of the shoulder which causes pain. That goes up to around 40 years of age. People older than 40 typically have problems that relate to the roof of the shoulder being sharp, causing damage to the rotator cuff and bursa below that, and they tend to have problems that relate to rotator cuff tears, rotator cuff impingement, rotator cuff inflammation. Some people will cross the boundaries. We have young people who have cuff problems and older people who have instability, but generally we can break it down by age. When people come in talking about their shoulder problems, we try to put them in the right slot to decide what can be done. In the younger people, it often ends up being procedures to stabilize the shoulder. In older people, it tends to be surgery to eliminate the spurs and take care of the cuff injuries.